just as a reference point, so different cues work for different people. You can see on our pelvis here, we've got these bony little prominences, okay? So on Naomi, we're going to come 2 centimeters in and 2 centimeters up with our fingers. Okay, so I'm gonna push my fingers in. Now this is just a reference point that you can do on yourself. So we're gonna go through some different cues that work for different people, okay? So what I want you to try to do is to pull your belly button down toward the floor for me. So pull that belly button down. Good, and relax. Good, so it's hard to see here, but she did that pretty well. What I want to feel is the tensioning of the muscles underneath my finger, but I don't want the muscles to push my fingers out, okay? So an example of a brace which would push the fingers out, if you imagine someone going to punch you in the tummy, you kind of, you tense it up. And if you do that under your fingers will be pushed out, okay? What we also don't want while we activate this is we don't want our lower rib cage to move, and we don't want our pelvis to move, okay? So we really got to try and establish control of this in isolation. So we don't want anything else moving. So that cue worked for Naomi, but there's a few different cues, okay? So we're going to think of the back of our spine and the front of our belly button, and you're going to try and bring those together. So you're going to try and close that in. Good, and so that worked for Naomi as well. Another one is if you think of the front of your bladder and the seam of your pants. You want to try and bring your bladder away from the seam of your pants there. So everybody works different, so we're just going through some cues that work. That's it. And the last one that's really common is if we think about coccyx and the front of our bladder, we want to try and bring those close together. Good. So when we're doing this, we want to do about 15 reps. You want to hold for 1 second and then go again. We want to do about 3 sets. And remember, there's no movement of the ribs or the pelvis here. Cool.